Assalamu alaikum. Now I would like to discuss about a very important topic, that is polycythemia. Okay, first look at here. In polycythemia, like if hemoglobin is high, if hematocrit is high, there may be lots of causes. It may be relative polycythemia, it may be appropriate absolute, it may be inappropriate absolute, and there may be polycythemia vera. In relative polycythemia, like due to burn or due to dehydration, there is relative polycythemia. In relative polycythemia only there is a decreased plasma volume. So primary disturbance of decrease uh, plasma volume, that is relative polycythemia. In relative polycythemia, there is decreased plasma volume. It is the primary disturbance. And RBC mass, oxygen saturation, and EPO level is normal. In appropriate absolute, in appropriate absolute, the primary disturbance is this one, oxygen saturation. So decrease oxygen saturation, like what is appropriate absolute causes, maybe lung disease, maybe heart disease, maybe high altitude, maybe obstructive sleep apnea, all these four. The common thing in here is hypoxia. So oxygen saturation is the must thing, is the primary disturbance of these appropriate absolute polycythemia. So in appropriate absolute, there is increased RBC mass, decreased oxygen saturation, and increased EPO level hypoxia causing increased EPO, and there is increased RBC mass. In an inappropriate absolute, the primary disturbance of this inappropriate absolute is EPO level, like exogenous EPO, also called blood doping and androgen supplementation. Blood doping and androgen supplementation and inappropriate hyposecretion is malignancy, renal cell carcinoma, and hepatocellular carcinoma. And in polycythemia vera, the primary disturbance is what? Increased RBC mass. Increased RBC mass. In polycythemia vera, there is increased plasma volume, increased RBC mass, and decreased EPO level. And EPO is decreased in polycythemia vera due to negative feedback that suppressing the renal EPO production. So negative feedback suppressing the renal EPO production. Okay, look here. In this question, what we found. In this question, 6 months history of 67-year-old woman, 6 months history of generalized itching, facial flushing. Okay, good. There is a blood pressure is 145/90. There is ruddy complexion, no rash. Ruddy complexion, no rash. And the splenic tip is palpated 4 centimeter. The splenic tip is palpated 4 centimeter below the left costal margin. There is no hepatomegaly, and there is increased platelet count. There is high hemoglobin, high hematocrit, MCB is high, and platelet count is high. So what is the diagnosis? The diagnosis is polycythemia vera. In polycythemia vera, the primary disturbance is increased RBC mass or increased erythrocyte mass. So additional studies. So Polycythemia vera, chronic myeloproliferation increase production of the erythrocytes secondary to JAK2 mutation. Leukocytosis, thrombocytosis can occur. Look at the leukocyte count is high, thrombocyte count. Leukocytosis, thrombocytosis can comes with pruritus after hot shower, secondary to increased mast cell production and degranulation, and there is increase in erythrocyte mass or RBC mass, and hematocrit can lead to development of these hyperviscosity syndrome, which causes blurred vision, central nervous system symptoms, headache related to vascular congestion. Patients are increased risk of venous thromboembolism. These patients are increased risk of venous thromboembolism. Additional patient can develop episodic severe burning pain in the digit with red blue discoloration secondary to clot formation in the extremity vessels referred to as erythromelalgia. Uh, Physical examination can show splenomegaly, congestion of the blood vessel such as plethora. Therapeutic phlebotomy results in decreased RBC mass and blood volume, which is the best initial treatment of these patients' symptoms. So increase the option D. If you look at the option D, increase EPO production secondary to can cause secondary polycythemia. It may be due to COPD, COPD, obstructive sleep apnea, cyanotic heart disease, as decreased peripheral oxygen stimulates the increased secretion of the EPO. Okay, so that is all about polycythemia and its primary polycythemia vera and secondary polycythemia. Hope you enjoyed.